Good afternoon, everybody. It is 4 o'clock, and we're here to give another update on this Commonwealth's war with the coronavirus. Let's remember, we are at war. It's going to take how long it takes, but we know if we don't put our best effort forward, that it will take the lives of our people, that it will hurt our economy, and that it will impact the education or the manner of education that our kids get. This is probably the most significant challenge that most of us will face in our lifetimes. We got to come together as a state. We all have to do what it takes. And we've got to make sure what's happening in other states doesn't happen here. You know, it's another day of tough news that we see across the country. Whether it is Dr. Fauci warning that a number of states, including us and those around us, are poised for a significant outbreak, for states in the Midwest now surging just barely behind some southern states that we've talked about, or record or high numbers of cases just to the south and all the way around us. I want to take a moment and show, based on data to date, and this is from one of the tracking websites, just how quickly this can get out of hand, but where we are as a state and the fact that we can stop it and stop it now. So I want to put some things in perspective. This is a graph that normalizes our number of cases. It's a 1-week average based on population. So the Florida mark isn't because they have more people. This is normalizing population. And we see in this chart just how badly Florida got hit and how quickly it can happen. That curve moving up gets pretty close to a straight line going directly up, and that is when they hit 10, 11, 15,000 cases per day. And you see other states like Louisiana and Mississippi that are in that very difficult spot right now. What you also see is states that may have similar populations to ours, seeing a very significant increase where they could possibly be just weeks ahead of us if we don't take action. One I wanted to point out is Oklahoma. You could see it wasn't that many weeks ago where they started having maybe a few more cases than we did. But once this thing really starts spreading, look at that last line up with Oklahoma and how quickly that looks to be escalating. And then look at Kentucky. This is an example of the hard work of the people of this state, but that line is going up. What you see are the times where we were doing a really good job and then when the virus started getting away from us. Our job right now, is to make sure that we don't have that increase you see in that graph in Oklahoma, and certainly make sure we don't go that same way as Florida. Right now, the story in Kentucky is so good that there is only one state, this is just of the southern states, there's only one state below us at the end of the graph that didn't have a significant spike early on. It shows that we have done one of the best jobs, but right now, from Dr. Fauci, Dr. Birx, from our Department for Public Health here, right now is the moment where we either stop this increase like you see in Oklahoma or in Florida, or we ultimately suffer the same fate. And we'll talk about our numbers today. They're a little bit more than yesterday. But right now, it looks like we are on track to be relatively stable as compared to last week's numbers, and that's a good thing. If we look 3 weeks ago, the week of July 6th to July 12th, 2,482 cases. But then we look to the week of July 13th, 3,772 cases. That is a really big increase. Last week, 3,918 cases more, but nothing like that week over week increase we saw before it. Right now, even with today's number, we are on track to be right around what we have seen the last 2 weeks. And I at least believe at this point that that is showing that our willingness to wear a facial covering is stabilizing our numbers or reducing the growth that we would be seeing right now, because every other state is seeing that increase. And while we are at higher numbers than we want to be, it looks at this point midweek like we may be able to level out these last 3 weeks, and we know we're going to plateau again before we decrease. So if this is where we are, and again it's hard because you really got to look at the data a week later, it's because of the hard work and the willingness of people to wear facial coverings. And it tells us that we really do have an opportunity not to go through what other states are seeing. And that's why we're acting. That's why we are acting decisively. We've taken the 4 steps that we knew we had to take. We instituted a mandatory facial covering order, and what this means is we protect each other. We've limited social, non-commercial gatherings to 10 people or fewer. Really need your help with that. We've asked bars to close for 2 weeks, and actually got a very thoughtful email from a bar in Lexington. I didn't know whose pictures we were showing or where they were. Very thoughtful about wanting to do the right things moving forward, and even trying to do the right things as the conditions existed on the ground. But I think everybody knows we've got to do a lot better in that overall industry than we've seen. And finally, for 2 weeks, limiting restaurant capacity to 25% indoor while trying to maximize or even increase outdoor dining. On top of that, if we can get people to stop traveling to states with over the 15%, and 15% is huge positivity rate, then we have an opportunity right here and right now to protect the people of this Commonwealth, to not have to harm our economy, to work to get our kids back in school. But as you can see by those graphs, we're maybe weeks at most behind these devastating impacts we've seen in other places, but we've acted a whole lot earlier than they have. The more people who jump on board, who help us out with these steps, the better we will be moving forward. We were going to show you today, do we have the video on masks? The first of what will be a number of PSAs that are going to get out there about the importance of wearing a facial covering. All scientists, all our public health have said that this is the number one thing that we can do to stop the spread, to get closer to our old normal, and it is supported by everybody from the federal administration to this state administration, and we need everybody to support it. Let's take a look.
Wearing a mask cuts your risk of COVID by up to 65%. Your mask shields you, people at high risk, and essential workers and businesses.
I wear my mask to protect my patients.
I'm a teacher. I wear my mask for my students.
I wear my mask to keep my customers safe.
It's simple, it's the right thing to do, and it works.
I may look healthy, but I'm battling brain cancer. I wear my mask for you. Please wear your mask for me.
I talk most days about different reasons I wear a mask: for my kids, for my faith, for my wife. Today I'm going to wear my mask for Ben Smith in that video, who's willing to share his story. We appreciate you. We appreciate everybody who helped out in that. Let's do the right thing. Let's make sure we mask up Kentucky. All right, today we're reporting 619 new cases of COVID-19. That is more cases than we want. Yesterday and the day before we had 522 and 532, but again, this is in the range that we have been seeing in the last week and a half. As long as we can keep our numbers around this point, then hopefully we can plateau, and as we move forward, eventually get back to a decline. It brings our total number of cases to 28,727. Our positivity rate, though, went up from yesterday, and that is a concern. It's 5.81%. We want to see that rate come down. Today's positives are out of a total number of tests of 10,738, brings our total number of tests to 609,989. Days that we have over 10,000 tests are good days for us in reaching the levels that we need to reach to really know what we have out there. We have 571 Kentuckians currently in the hospital for COVID-19, 112 currently in the ICU. New cases by county: Jefferson with 101, Fayette with 64, Warren with 45, Christian with 35, Pulaski with 22, Bell with 21, Kenton 18, Scott 18. Scott's been hit very hard recently. Hardin with 17, Oldham with 15, Barron with 14. Barron also hit hard day over day these last 6 or 7 days. Boone 12, Davis 10, Pike 10, and a number of other counties coming in right under that. There are a lot of these that are hard to read. But we're now giving this report of kids under 5, and I keep wanting a day where we don't have any, and we're just not moving the right direction with it. 17 kids today under 5 years old who have tested positive. The youngest just 4 months old, and they are in all different counties from Hopkins to in Clark, Allen, Boyle, Christian, Perry, Trumbull, Warren. Just remember, you wear your mask for your kids too. None of us want to ever have to live with the knowledge that we may have spread this to our children, even though it happens. Let's just make sure we're doing all the steps to reduce that probability of it ever happening. Today, we're announcing that we have lost 5 additional Kentuckians to COVID-19. 58-year-old female from Knott, a 77-year-old man from Jefferson, a 71-year-old man from McCracken, an 82-year-old man from Graves, and an 87-year-old woman from Clay County. I'm also pleased to report that the good work of our medical community has also decreased our mortality rate. We are down from 3% to, I think, right around 2.5%. And that is based on really good work. But remember, if we're having 600 cases a day, 2.5% starts adding up pretty fast. So let's make sure that we stop the spread, because we know that what follows high cases are high death counts, and none of us want to see that. We've now lost 724 Kentuckians to COVID-19. 4 are probable, the rest are lab confirmed. I remember when we started this, the numbers of people that they thought we'd lost were huge, unfathomable. It made it difficult to even talk to people around me. I'm trying to process that information. As time went on, as we started doing really well, those numbers came way down. But right now, with what we're seeing across the nation, some of those numbers, 2,000 that they threw out for Kentucky, all of a sudden seem like they're realistic, or they might even be low unless we get a hold of this. So I'm asking, and I'll plead, I'll do whatever it takes for people to take this seriously, to understand what we're facing, to not go on a beach vacation to these states, to be really careful if you have to travel for business, to wear that facial covering, to not have a big old house party. Protect yourselves, your neighbors, and those around you. Ethnicity and race information: overall cases still at about 85% non-Hispanic and 15% Hispanic, 78.75% white, 12% African American, black or African American, about 6% multiracial, about 2.5% Asian. On deaths, it's about 96% non-Hispanic, 4% Hispanic, 81% white, 14.5% black or African American, 2.5% multiracial, 1.65% Asian. Long-term care. Again, we're going to work on a way to where we can make this data more present, if you will, to give us a better idea of what we're dealing with this moment. This is all cumulative data. So these cases could have been in early March. The facility could have fully stabilized, and so we realize we need to give a better picture of the day-to-day, and we're working on that. But we want to make sure that we are still transparent with this data, and we continue to show the cumulative impact this has on long-term care. So 23 new residents have tested positive and 1 new staff, and we've had 3 additional deaths of residents. There's 1 new facility there. Now, but it's especially this facility number that I want to make sure that we can try to get, and it's going to be hard, and active cases number, so we know how many are actively dealing with an outbreak. We ask a lot of our facilities, we ask a lot of our hospitals, we ask a lot of our labs on how they report, so bear with us as we try to get some better data here. So more cases than we wanted today, but if we'd gone back 5 days ago, our worry 7 days ago was that we would be seeing that 800, 900 number. By now, that hasn't happened yet, but we are nowhere near out of the woods, and we're not going to be for at least a couple weeks. That's why we have to do these things. That's why we have to be diligent. And that's why we want to show folks out there who are doing the right things, who are working really hard day in and day out and showing that positive example. So let's start. This is a post by a parent who's saying that she wears her mask to keep her daughter safe, who is right here. And if you notice, her daughter's mask even matches the bow on that poodle. That's pretty special. This is Bella and Zodiac. And you know what? Even in the midst of a pandemic, they still seem pretty happy. All right, let's go to the next. This is pretty special. This is somebody I know who's talking about their daughter moving from the why to what happens if we don't. Asking about a mask for a quick errand, I said others could get sick if we don't wear a mask. She said, well, we should wear one then. That's wisdom from a 3-year-old. All right, other reasons that we wear a mask. Look at this. This is an orthodontist doing it right, but look at everything that they have to put on because of this virus. Let's make sure we don't take actions that would otherwise expose them. And when you walk into a place and you see this, you know that they are doing everything they can to ensure they are not causing the spread. All right, I'm going to admit something to you. We've talked about Kenneth helping out. James helps out too. This is James's kiddo. This is them showing their green lights. This is his kiddo taking a quick look at it. This is what we do for those 5 families today, or those other families who have suffered, to show that we care about them. And as we ask people to cut back their social interactions, it's just, again, a reminder that we are not alone. And since today is apparently Family Day, I got one more for you. This is my wife, your First Lady, Brittany Beshear. And I love her with all of my heart. This is not something that she would probably take a picture of and put out, but she wants to be there for all the kids across the Commonwealth. She sets an amazing example. I could not be luckier. And having her to help get me through this, but hopefully to help everybody else too, is pretty special. Now, she recently had a birthday. I'm not telling you what birthday that was, and that's not an open record. But that's her. That's the little hat that we had for her birthday. And you know what's so funny is the kids wouldn't pose for something like this, but she got up and did it. So, Brittany, I love you. Thank you for everything you were doing to help us get through. All right, quick update on unemployment insurance. The week of August 3rd through the 7th, we are going to be doing in-person unemployment by appointment in Louisville. We're going to have a significant number of people on hand. It's going to be Monday through Friday, and the location is here. So get on and sign up. We believe, based on the work of E&Y and our people, that most people who will come have a claim that just has a little bit left to be done, but we want to see those that believe they need to see us in person, in person. And I just saw a headline come out. Let me also say that today the UI proactively reported a data breach in the system. What this is one or possibly 2 individuals that we know of right now at most that weren't able to see anybody's name or social security number or birthday, just employer information and one line about an individual's health. Now, there might even be a question of whether that qualifies as a data breach, but wanting to be completely upfront and out front about it, we made sure that we provided that notice and those individuals will be contacted. Just like with the first data breach, absolutely no one to our knowledge has been financially harmed whatsoever. And at this time, we don't think that there is a threat to anybody's credit or financial information at all. But our challenge is this system was put in 2000. Could you imagine if the computer system that you had in 2000 currently had to protect critical information of almost 1 million Kentuckians? It's what happens again when we starve a system. And we're doing everything we can every day to protect and patch. That's what it's called. We have to patch the vulnerabilities in the system because it's so old. Let's make sure as we move forward that we invest in our infrastructure, IT and otherwise, to make sure when something like this happens again, we aren't in a situation where we have to bring in special people because many of the people working on our computers weren't working on computers 20 years ago. I remember mine, it was very different, as I'm sure everybody else's was too. But there is no reason at the moment to think that this has put any of the financial or otherwise concerning information of anybody out there in any harm whatsoever, but we're going to be up front. We're going to make sure we get all of that information out. On the initial data breach, I believe we will have a final report by our Inspector General here in the coming days. And I believe that what it'll show is that on the technical side, the response was everything we'd want. Was shutting down the system, getting it fixed, protecting that information. On the reporting side, I think we're going to find that a better job should have been done, that policies had been in place that shouldn't be in place. Those policies, I believe, were wrong under the law. And then there were some either mistaken advice or failure to notice mistaken advice. But we're going to be clear and transparent about all that. That's the way that we make sure that it doesn't happen going forward. And once we have that report in, we will be providing it. All right, now we've got an update on COVID-19 in our state prisons, and then we'll open it up to questions.
Thank you, Governor. I'd like to, it's been a few days since we talked about where we stood as far as the outbreak in our prisons. So before I give you today's number, I want to do a little bit of context and take you back 2 weeks ago to July 14th. And at that time, we had been reporting that we had COVID positives on 83 staff members, 624 inmates, and we had 4 inmate deaths. So that was about 2 weeks ago. Fast forward to today. Today, the numbers would be that we have 122 positive in staff members, 811 in inmates. The death total has gone up to 8. I will talk about that in just a minute. And as of today, we currently have 9 inmates that are hospitalized. But contained within those numbers are some other numbers which are important to note, which are that we've had 432 inmates recover, 69 staff recover, meaning that our active case level as of today is 53 active staff, 379 active inmates. Again, a total of 8 deaths. That most recent death occurred at the Kentucky State Penitentiary, relatively young person, 37, and that was the first positive test we had at the penitentiary. And we have 9 inmates now hospitalized. Looking at successes, Green River, we consider stabilized and recovered. But looking at the same 2-week period, we need to turn our attention to 2 other primary places. First is KCIW, the Institution for Women. On July 14th, we had 19 staff and 207 inmates test positive. On today's report, we have 31 staff and 236. So we've seen a jump, but not a logarithmic jump. At KSR, a little more concerning. On the 14th, we had 6 staff and 49 inmates. And as of today, we have 18 staff and 190 inmates. So we can see that that's a place that we're going to have to monitor carefully. We've had 4 deaths at KSR, and all 9 of those who are hospitaled are from the reformatory. The last place we're taking a look at, the newest one that sort of popped up on the radar, is from North Point, where we have 10 staff and 16 inmates. The last thing I'll comment on, you've heard the governor talk about his program on commutations. We have released right at 1,200 inmates from our previous round of commutations, and I can report that as of today, we are currently in the final stages of screening another 700 inmates to see if they qualify under those previous criteria for release. Thanks.
All right, we will open it up for questions and go for a bit.
Breach. Sounds like it's very similar to the first one. In that case, what was done afterwards, and how was it able to happen again?
So on the data breach that was reported, I believe that I would classify this one, from what I know about it, as much more minor than the first. That the information was less sensitive, in my opinion, than the first. There might have even been a legitimate question on this one about making the report, but we're going to make the report. Right now, we're analyzing it to make sure that it's not a wider spread problem, and working on the COT side to ensure that it doesn't happen again. But I will say that that's the Commonwealth Office of Technology. Those are our computer folks, that they have done a really good job in their responses.
Viewers that are talking a lot about that they are still waiting, I guess, on their final $600 check or advance. So I guess just the simple question is, what's the update on that? Is there an update for them?
So the question is about the final $600 check and people waiting on it. So if that would mean that they had been approved previously, that they had been receiving payments, as long as they went in and requested, because you got to request every 2 weeks, that week, then that payment should get out to them. But let me comment a little more broadly on the fact that that extra $600 is now no longer going to be paid out unless the federal government takes action. You have economists all over the country saying that if the federal government cuts that extra $600 pandemic payment, that it's going to significantly harm our economy. It will, and it will harm our state budget. If they do a big change in the calculation of people's benefits as opposed to an add-on, it's also going to take us and every other state a significant amount of time to redo our system so that we can recalculate people's benefits, and that's going to create a delay. If you say now we're not going to calculate people's benefits by X percentage and then you can get an extra 600, but by a different Y percentage, we got to go back in and do a ton of administrative work. That's going to slow down people's payments, and I seriously hope that they don't do it.
That it could be on the federal government's end of why they still haven't received it?
Well, we believe that if they filed for a week that they should be getting the $600 payment, that should be going out, shouldn't it, Amy? So if we'll continue to monitor it, and the first question I would have is, did they make the request 2 weeks ago for the 2 weeks that are involved here? But we haven't otherwise heard of that extra $600 not going out to people who are entitled to it.
When exactly, the second one, did this happen? And you know as well as I do that the Republican Party has been fairly critical of the administration, has even called the lack of reporting on it, or perceived lack of reporting on it, illegal. How do you respond to criticisms about the way it's been put out there and communicated?
I'm not going to respond to criticisms from the state Republican Party, because in many instances they exist to criticize me and this and any other circumstance. And as a governor trying to do the right thing in a system that doesn't have anything to do with politics, a political party jumping into it is interesting. This data breach is a type that occurs around the country, unfortunately, regularly. There's so much data that is online. There are so many different systems that are out there. As Attorney General, I would get notices of data breach, sometimes dozens every week. I don't like that it happened in our unemployment system. Right now, this one doesn't appear to have put anyone's sensitive data data that could be used to financially harm them out there. But I think we reported it, I mean, certainly within 24 hours of when they first learned about it. And this was one where I believe we got a report from a news agency. And when we got that, we reached out to the specific individual to see that it happened. And once it did, once we even got that information, we put out that notice. So I think this is one that shows full and quick disclosure, even though right now it does not look it does not look concerning to people's credit or their finances.
Senator Ralph Alvarado today at the Health and Welfare Committee meeting chastised the administration for not returning phone calls, texts, and emails when he's asked for information on one thing or another having to do with the COVID. What's your response?
Well, apparently today, Senator Alvarado claimed that the administration doesn't provide information and hasn't returned calls. I know of 2 attempts directly by Dr. Stack to call Senator Alvarado after he sent a text, and Senator Alvarado never called him back. So let's at least be forthright about what we're talking about. Also, I was pretty concerned in today's hearing where someone was there to talk to the committee. If you want to make a criticism that we don't talk, that person was cut off, a speech was made, they gavelled out and left. I mean, we're over there in ability to testify, to provide the information, at least allow the provision of the information. And I'm not going to attribute that to everybody else, but I thought that today's was a little bit silly, and we don't need to be engaged in that type of silliness. And for things to break down to, you don't call me enough. I mean, we're over here. We're right across the street from where they meet. We're accessible. I haven't turned leadership down for one meeting they've asked for. We've been calling them about announcements we're going to make. Let's move on from this silly attempt to try to couch people being opposed to the steps we're taking as you don't call me enough. Listen, if you're against the steps we're taking, own up to it, and we can talk about it. But the "you don't call me enough" that's a new one for me.
On the in-person availability next week at Louisville, do you know how many claims and process things that are in Louisville, Jefferson County? And along with that, is 1 week going to be enough?
The question is on the week that's going to be done coming up in Jefferson County. Do we have a breakdown of the claims of how many are in Jefferson County? I don't have that. We'll see if we can do it. Again, with a 20-year-old system, I can't promise you that we can sort it in any particular way. So I believe that people come in will likely be in one of 2 positions. Number one, they'll have filed an initial claim that hasn't been approved or denied, which means they're probably one of the 63,000, which is a little bit less today, awaiting on that 2-page letter. If so, maybe we can speed up that 2-page letter while they're there. The other position that they could be in is that they initially got approved, but something happened in subsequent requests for payments. Those can be fixed pretty quickly, and they may in fact get a call from EY to fix that before they even come in. Those are the 2 most likely circumstances that they're facing. So 1 week, I think we'll get through a lot of claims. Will 1 week be enough to get everything? No. I mean, right now we just have so many claims filed every day and every week that we don't have enough people for any place for 1 week for it to truly be enough, and we're working on that. But I want to make sure I'm transparent with people about we are maximizing the resources we have and building on them. But it's still going to take some time, and we still got work to do. So the question is on a second round of commutations given COVID. It's the same exact criteria that we looked at before, and I'd want to see it, but it's nonviolent, non-sex offenses where there is a relatively small amount of time remaining on people's sentences. I believe there's a few other things that we consider. There is one of serious medical conditions, and there's a slightly different lens we put that through, but those are the overall parameters, and we're looking at trying to do it the exact same way we did before. Here's one thing that we don't necessarily do, though, is we go by the charge. because ultimately, if that's what someone pled to, that's what was agreed to. I know there have been a couple of stories about somebody did something that we might consider considerably worse, but then somebody pled it down significantly. And I think that in the justice system, when you ultimately reach that plea, that's what that person has been convicted of. All right.
The steps that were taken at Green River to get that outbreak under control being taken at these other prisons that we're talking about today?
Yes, the steps taken at Green River are the model that we are using in our other institutions to try to get this under control. Some lend themselves more to that model than others. If you remember, we put a map up of Green River, and we could point to 5 different buildings where we could put the positive people, those that had been around the positive people, the medically fragile, the negative, and we could spread them all out. Some of our institutions means that we have to do that in wings, and that's not as good as separate buildings, but still we're using that overall, get everybody tested, sort them out, do the monitoring, and we believe it can and will stabilize once we go through that. But let me say to those with family members, and it's got to be really scary. Like when it goes through a long-term care facility. I can tell you from the administration side, we care. We care, and we are putting significant resources towards trying to address it. And I want to make sure we acknowledge that some of our incarcerated Kentuckians have done a heck of a job in helping us fight this virus, especially in the manufacturing of masks and other PPE that have been so crucial in this battle.
Another question from a viewer, and I'm sure you've taken this question a lot as well. It's about protest. And there is many viewers, and well, obviously the public too, out there that say, why is there a mandatory social gathering mandate, I should say? And then why can people still go out and protest, large groups? What's your response to that question? I know you've gotten that question a lot.
Yeah, the question is, what's my response to people saying, why should I limit my house party to 10 if there are protests out there with a lot more? And let me answer it in 2 ways. First, I was taken to court over the mass gatherings as it applied to protests, and we have multiple judgments entered that we can't stop one of those gatherings from occurring. I think that was one of the ones that the AG had filed. But let me move beyond that. If our standard for our behavior is, well, I see another person not doing it, then we're not going to be able to stop this virus. If we step back and take protests out of it and just say, wearing the facial coverings, 100% of people aren't going to do this. But if the vast majority of people see 1, 2, 5, 10 other people not doing it and say that I'm not going to do it, then we won't hit the numbers we desperately need. I'm asking everybody to do the right thing because they believe that it is the right thing. Even our faith compels us that even when others aren't practicing what we should be practicing, that we're still supposed to do the right thing. And doing the right thing isn't supposed to be easy. It's not supposed to make you one of a large group. And practicing your faith isn't supposed to make you part of the in crowd. It's supposed to be hard on most occasions, and I'm asking people to do the hard thing and do the right thing.
Just asked, but as far as the computations for the 700 or so inmates, do we know when that's going to happen or when that's going to be?
An additional commutation process is in process, and what happens is you get the initial pull, and then you got to be really careful and go through the list one by one on the charges, on the time that's left. The first time, I believe that it was very close to ensuring that every single individual fell within very defined parameters. And I think those are parameters that people can accept and understand. It means if you committed a nonviolent, non-sexual offense and you're pretty close to completing your sentence, in other words, you've paid most of those dues to society, I think people can understand in a pandemic when we would make a step related to that.
Talked about for a little while, contact tracing.
Yes.
How are we doing that? How many do we have on board? Are you looking for more? Where are they working on? Are they working on Health and Family Services? Are they working all over the state?
Question is on contact tracing, and I tell you what, we'll get Mark Carter to come tomorrow as long as his schedule allows him to and give an update on it. So contact tracing, we got a couple of things in place that's important. We have a new statewide system where everybody can be on the same page. We can share that information, and that's important because people can spread this from one local health district to another. We are working to get all the local health districts on board using that, and that's a system that we can use for every other virus or issue in the future that we need to contact trace. We brought on a significant number of people. I don't have the exact number on the state side too. They fall into regional folks as well as kind of frontline contact tracers themselves. I think we are doing more of it, and some areas are doing really well. I will say that the Warren County area local health department has done a great job in identifying clusters. They work really hard, and we need to make sure that we're all working hard. Now, we have 600 cases a day. Like Dr. Stack has said, we can't test or contact trace our way out of that. Because if we have 600 cases a day and we need everybody who has been in contact with them to quarantine for 10 days, that's going to be more people than we can make effective. So what we've got to do is wear these masks, don't travel to Florida or Texas or Arizona, limit our social gatherings, asking our bars and our restaurants to make sacrifices, get those numbers down and get them to a level where we can be effective in the contact tracing, and then keep those numbers down. Now, it has been really effective in areas that matter a lot to our lives, right? If somebody on one of our kids' sports teams tests positive, letting everybody know. If somebody in our work tests positive, letting everybody know. I think the major impact it's having right now is it's letting people know that they should go get checked out, that they could see a health issue, and making sure that they're on top of it. It's going to be effective in the end, but even if it's only 1% effective, that's going to have saved lives, and it'll be well worth everything we invest in it.
I've not checked this myself, but I'm getting the message that the website to make an appointment is not working properly. Are you aware of that? And how can people, if that's the case, make an appointment?
If the website for unemployment is not working properly, we will get that fixed right now. Right, Amy? We will be on top of it. First, let's make sure it's fully activated, because this was the day we were going to announce it, but we put it out earlier, so it should be. Oftentimes when we put it up for the first time, within the first hour, the volume is an issue, but we typically get that righted within an hour or so. We'll get it fixed. So I saw a request or a letter on providing a photo ID to people as they are released from jails or prisons for the first time today. And it's something that I want to understand and look at. It was couched in terms of helping with the health and ultimately relocation or return to society. I want to hear that out because we've got so many, even before the pandemic, we have so many challenges that people face when they are released from an institution and successfully, reintegrating with society. And if that's one that there's some data on where it can provide real results, that's something that I want to take a look at. All right, so today's numbers higher than we would have liked, but again, suggest right now we're holding just about even where we were last week and maybe even where we were the week before. If that's the case, it's because more and more people are wearing that facial covering, and ultimately it'll be impacted by additional steps we've taken. We are all in this together. We're going to get through it, and we're going to get through it together. But we need everybody's best every day. Let's not try to make excuses. Let's just try to do the right thing because it's the right thing. We in Kentucky, can you put up that graph we showed with Oklahoma, are at this point. I've been trying to talk about it in a way, but maybe this is the visual way. We are at that point where first we'd be Oklahoma, and second we'd be Florida. But none of them knew what we know right now, and none of them took the steps at the time that we are taking them. So let's make sure that we make those steps as effective as they can be. It's very rare that you can see something that would be devastating before it happens and have a way to stop it. I'm not just hopeful, I believe that we're going to do the right thing. We are going to get this escalation stopped, and we're going to make sure that Kentucky is still a success story. Take care of each other. Thank you very much. Thank you, Virginia.